Why are PET scan results for colon issues sometimes ambiguous? When it comes to diagnosing colon issues, positron emission tomography scans, or PET scans, can sometimes lead to unclear results. This ambiguity arises from a mix of biological and technical factors that influence how these scans work. One major reason is the variable metabolic activity of tumors. PET scans detect cancer by measuring how much a radioactive glucose analog is taken up by cells. However, some colon tumors, particularly small ones or certain types like mucinous adenocarcinomas, may not absorb much of this glucose. This low metabolic activity can result in false negative findings, meaning that cancerous lesions might not show up on the scan. On the flip side, there are also false positives to consider. PET scans can pick up increased metabolic activity from inflammation, infections, or benign growths, such as adenomas. This can lead to confusion, as non-cancerous tissue may be misidentified as cancerous, adding to the ambiguity of the results. Another factor is the resolution limits of PET scans. These scans may struggle to detect very small lesions or polyps in the colon, especially those smaller than 1 centimeter. This limitation can create uncertainty in both diagnosis and staging. Additionally, normal physiological processes in the colon can sometimes mimic pathological uptake on a PET scan. The surrounding tissues may show variable metabolic activity, which can obscure the distinction between healthy and unhealthy findings. To improve accuracy, PET scans are often used alongside computed tomography scans, known as PET-CORT scans. This combination helps with anatomical localization, but even then, some ambiguity can persist. For instance, differentiating between scar tissue, inflammation, and active cancer can be challenging, particularly after treatment. Given these complexities, it's crucial for healthcare professionals to interpret PET scan results carefully. They must consider other diagnostic information, such as findings from colonoscopies, biopsy results, and additional imaging studies. While PET scans are particularly effective for detecting metastatic disease and recurrent cancer, they are less definitive for initial diagnoses or small primary tumors. In summary, the ambiguity of PET scan results for colon issues stems from the low metabolic activity of certain tumors, the potential for benign conditions to mimic cancer, and the challenges in detecting small lesions. These factors highlight the importance of integrating PET findings with other clinical data to ensure accurate diagnosis and effective treatment planning. Always consult with a healthcare professional for personalized medical advice.